It's always important to have an instruction sheet. Okay. I chose three things that I thought were important no matter where you are and what you're looking at any time in terms of a pregnant woman or a child. And the main issue is, what are the factors that cause disease? And when you look at mechanisms, I feel that stress was the beginning of my career many years ago. I felt that stress was important as a cause of preterm birth, but no one believed it. It wasn't even listed as a cause. And but as I learned more about stress, I think inflammation, and this is not an infection, it's silent infection, silent inflammation. Inflammatory response has a dramatic effect on all systems within the body. And so I think that one needs to look at infection, but the origin of inflammation. So, and then the third thing, I think something as simple as nutrition. Nutrition is the basis for many problems that we have in medicine. And I don't know if you've heard of the Barker hypothesis. David Barker was a famous epidemiologist in England who about 15, 20 years ago analyzed the birth records in London and determined that there was a relationship between poor fetal growth, low birth weight, and a greater risk of cardiovascular disease, stroke, and hypertension later on in life. And it was all essentially related to poor nutrition and poverty. And as I look at a lot of the issues today, poverty is a major problem that we have today in terms of lack of resources and access to health care. So I want to look at stress first. A little bit of history of the stress pathway, the types of stress, and the role of the placenta. Actually, the placenta is an extra brain during pregnancy. It plays a very important role in metabolic homeostasis between the mother and the fetus. And I think it's a very important part of our understanding of the origin of diseases. Now, this actually is a circa 1984. Many of you weren't even born in 1984. But the central hypothesis at that time in terms of the cause of preterm birth was stress. And that's listed in the middle and the top, related to personal maternal characteristics, maternal behaviors. And then there's stage 1, stage 2, stage 3, all leading to increased uterine activity in the middle, and then cervical changes, and then preterm labor. But look over on the left. Stage 3A was introital infections. That's asymptomatic. Decidual cell stress, disruption in the uterus. Those are asymptomatic. So most women who have preterm babies are asymptomatic for a long time before they deliver a preterm baby. But then in stage 3B, it becomes symptomatic with cervical changes and preterm labor. And then in the hospital, we get preterm labor and try to manage it. And it's very difficult. You can stop it for a short time. You can improve lung maturity of the fetus and decrease poor outcome. But so it's taken a long time to assess sort of the background that leads to this type of stress. So early fetal and childhood adolescent experiences, top on the list. This is really important, but when you look and try to assess stress, you have to look at things like that, psychosocial, mental stress, life events, state anxiety, racism, pregnancy-related depression, work, physical activities, poor nutrition, smoking, inflammation. All these are interrelated. So stress is complex, but stress is normal. we could not respond to things if we didn't have stress. And our adaptation and ability to adapt to stressors helps us have homeostasis. But if you have too much stress over time, that's when there's a problem. And my son's a pilot, he's a Navy SEAL. To hear the experiences that a lot of soldiers have today, and so much post-traumatic stress syndrome, brings up this issue. And I talk to my son a lot about, my son is very well adapted. He can deal with almost anything. I look at it as an effect of the child development and what we did as parents. However, there are a lot of soldiers that I think that have post-traumatic stress syndrome because of events in their early life that increase their stress reactivity, and that we get into a situation of a war, you can't deal with it. And there's so much today with people that have post-traumatic stress syndrome and suicide. This is something that's very difficult to deal with. The question is, can we predict it? And then not allow people that have prior stressors and increased stress reactivity to even go into the armed services. Today, I'm very interested in the origin of cardiovascular disease in women. The question is, how soon can we diagnose it? But today, by looking at pulse pressure waveform in your finger, look at the waveform of your pulse pressure, you can actually diagnose early cardiovascular disease by 18, 20, and it's even being studied in children today to look at stress reactivity in children by just looking at the pulse pressure waveform. So we have a lot to do in this area to try to improve our understanding. So I want to show you just a study that we did. This study was done 20 years ago. We're now looking up the women that participate in the study and to look at their children for risk of cardiovascular disease. We begin following women at 20 weeks of pregnancy, and then the second trimester, 28 to 30 weeks. But I just want to show you a little bit what happened. Now, what's unique about stress? Well, I said the placenta. Now, normally on the left side, when you're non-pregnant, you don't have a placenta. And when you have stress going from the brain to your adrenal gland, you can shut it off quickly. But in pregnancy, when you have stress, it produces cortisol, but then the stress causes stimulation of the placenta to make corticotropin-releasing hormone. The main stress hormone made in the brain, in our brain, but it's made in the placenta. So stress during pregnancy turns on the placenta to send a signal to the fetus that things aren't going well, and you may have to get out early, and that's what causes preterm birth. Now, when you look at on the left side, that's at 18 to 20 weeks, you can see the normal people, the controls, who don't have preterm babies have very low corticotropin-releasing hormone, but look at the ones who have preterm birth. Very high. Looking at then 28 to 30 weeks, the metrics change because the levels are going up. Again, it separates out perfectly. Only one person who was normal had an elevated CRH. And the same thing happens at 35 to 36 weeks. So this is a metric that can be used to diagnose risk. But then this is something that we noted 20 years ago, but didn't understand it for about 10 years. When you look at corticotropin-releasing hormone on the left, and the yellow shows an increasing corticotropin-releasing hormone when your perceived stress scores on the bottom increase. So the yellow line goes up. But look at the women who delivered at term. The line goes down. The more stress you have, the less CRH you make, the placenta makes. Someone told us that they knew what it meant, but they wouldn't tell us. But over the years, we realized that probably it goes down in normal people because of resilience. Now we're very interested in, well, what is resilience? What allows people to adapt to stress late in pregnancy when they have a lot of stress, but their CRH levels don't go up and they don't deliver preterm? So trying to understand people's behavior is very important. Now, inflammation. Inflammation is an inflammatory response and is one of the most serious problems in medicine that is very silent because a lot of people have inflammation but don't know about it unless you measure it. It's asymptomatic. But what are the diseases where inflammation is important? This is the most important paper that you need to know about. This was published in Science, 2008, and it's how bacteria and infections stimulate the immune system to allow you to prevent infection. This was published at UCLA, but in 2008, so this was just very recent information. But this is an immune cell. If you leave today with any information, this is something you should look at. And I gave you the paper we wrote about this, and if you print it out in color, it looks like this. But this is an immune cell. Let me show you the mechanism that infection. So when you have infection, it stimulates the yellow toll receptors up in the left-hand top. It sends a signal, that yellow area, into the nucleus of the cell, turns on gene expression that allows hydroxylase enzyme to then go into the cytoplasm, and then see that 25-hydroxy-D, that's vitamin D, the sunshine vitamin. You saw the nice presentation of the child and the mother walking from the house outside, and what did it show? The sun was shining, and the mother says, I feel good. What's the message? Sunlight allows your skin to make vitamin D, and then what does the vitamin D do? The vitamin D goes into the cell, along with hydroxylase. It's converted to active vitamin D, 125 dihydroxy vitamin D, that goes back into the nucleus. And then the nucleus turns on another gene for cathelicidin, which goes back in the cytoplasm, and it kills bacteria. It's a natural antibiotic made by vitamin D. So if you're vitamin D deficient, you won't make that peptide. But this was what allowed sunshine to cure tuberculosis before we had TB drugs. People would go to Denver, Phoenix, Florida for sunshine in the treatment of tuberculosis. Half the people got well naturally. I mean, no one knows about that, but it did happen. But the study at UCLA proved that it was through vitamin D, production of a bacterial product, an antibiotic product in the macrophage that killed bacteria. So vitamin D today is rampant in the United States. Half of people are vitamin D deficient. It's associated with preterm birth, cardiovascular disease, and depression. We now just finished the second study at Cedars, where it shows that vitamin D deficiency is significantly related to an increased risk of depression during pregnancy. And it gets worse during the postpartum period because the vitamin D is used during pregnancy to support bone development of the fetus and actually keeps the uterus quiet. And so we are now beginning to supplement all women with vitamin D during pregnancy. I just finished writing a paper for the British Journal of Obstetrics and Gynecology. I was invited to present a paper on routine vitamin D supplementation in all pregnant women. It's safe, and because 40% of women are vitamin D deficient. So it's important for depression, preterm birth, postpartum hemorrhage, because it plays an important role in muscle function, decreases cardiovascular disease, but it's not the panacea for the treatment and prevention of all things. It's only one factor. The other factor is inflammation. However, but if you prevent infection with this vitamin D effect on immune cells, that will decrease the amount of infections you have, decrease inflammation. But there's one other cause of inflammation, which I won't really get into, and that's obesity. Vitamin D is soluble in fat cells. And so when you're vitamin D deficient, then you're at more risk for inflammation. And I want to just jump ahead. These are the conditions of complex diseases. I look at preterm birth as a complex disease, diabetes, obesity, anxiety, depression, cardiovascular disease, autoimmune disease, and even cancer. Two cancers that are most important is lymphoma and prostatic cancer that's related to vitamin D deficiency. Now, this was a study we did a couple of years ago. This is looking at our data set on preterm birth. You can see that from the mid-pregnancy, 18 to 20 weeks on throughout pregnancy, the vitamin D levels in control patients naturally drop as pregnancy progresses, because vitamin D is very important for fetal development and for the mother. But look at what happens in the ones who delivered preterm birth at the bottom in red, significantly lower levels of vitamin D in women with preterm deliveries. I'm going to jump ahead. This is a slide showing how vitamin D affects all systems in the body. Vitamin D is an important part of evolution. We would not be on this earth if it wasn't for sunlight. We could not live. Sunlight is very important. It's an evolutionary part that has been conserved primarily in primates. And the important part of evolution is that when Africans migrated from Africa to the northern hemispheres, they had increased risk of vitamin D deficiency because in the northern hemisphere you don't have enough sunlight. And so gradually, actually pigmentation changed over many thousands of years. And this all happened before the birth of Christ. I'm a very religious person. I believe in Christianity. However, evolution today has played a very important role in preparing us to live on this earth and change the way our behaviors. Okay, I want to just, when you look at the origin of adult diseases, we call it fetal programming. Actually, all of these systems, the pulmonary, placenta, kidneys, the pancreas, beta cell production, heart, adipose tissue, all of these have a very important role in metabolic regulation. And vitamin D affects all these systems. It's just one thing. Inflammation affects all these systems. So when you have inflammation and vitamin D deficiency, you have all this metabolic dysregulation that leads to a greater risk of disease. And one of the vulnerable parts of the human body is the brain. That's very vulnerable, just like the placenta. Okay. I want to show you a recent study we just completed. I'm going to just skip through this. I don't want to take too much time. But one of the big problems of obesity today, normal development in the mother during pregnancy leads to a normal birth weight infant, but if the baby is too small, that's a problem with increased risk of adult diseases, increased risk of diabetes. But when you have on the adult offspring side, when you have an obese child that's too large and then grows excessively during the first year of life, it goes back, and when it becomes a mother, also delivers macrosomic babies, leading to obesity, hypertension, and diabetes. So it goes from generation to generation. So the question is, how do you stop it? You stop it by improving health of children who are going to have children themselves. Now that's a big challenge. But I want to show you something about, we just finished a study where we followed a large group of women. So I took all the women who had normal BMI, 89 subjects, compared them to women that were overweight, had a BMI of 25 to 30, and those that are obese. And most of these women were having their first child, 45% having their first child. And I want to show you what happened. In order to quantify what happens, risk of disease, we looked at several metabolic systems. Cardiovascular on the left, metabolism, measured by hemoglobin A1C, HDL, and BMI. Central nervous system, we use vitamin D because it affects the brain as a marker. And then the bottom red is inflammation, C-reactive protein. So the biomarkers that we measured, I want to show you what happened to them. When you look at normal women, you look at their vitamin D levels, much higher than overweight and obese women. Significantly different, a big difference. This is a cartoon. It helps people to kind of wake up and get excited. But this is Peanuts sitting on the beach. Now, whoever put this together knew something about sunlight. It makes you feel good. When you go outside, it makes you feel good. Peanuts. Oh, good grief. Another note from his mother in his lunch bag. Are you sitting in the sun? I hope so. For a little sun is good as long as we don't overdo it. Perhaps 10 minutes a day this time of year is the right amount. In my mother's brochure for pregnancy, published in 1935, that's telling you about how old, I'm not quite that old, but it's getting close. But in the brochure, had stuff on breastfeeding, nutrition, and take your child out in the wintertime, twice a day, 15 minutes exposed to extremities to sunlight. And then, after breastfeeding the baby, give your baby a drop of cod liver oil. Cod liver oil has omega-3 fatty acids, which is good for you, and it has vitamin D in it. That's what my mother gave me when I was young. I grew up in Nebraska, so it was, okay, so, oh, by the way, then we looked at C-reactive protein. Look at the increased amount of C-reactive protein, which is a marker of inflammation. Almost done? Okay. So we then put all these markers together because I wanted to know how many normal people are healthy. So on the left, using the blue line, 80% of normal people are healthy, but 20% are unhealthy with biomarkers. But when you look at overweight, very few are about 20%, maybe 30%, and then obese are about 15% are healthy by markers. But none of these obese women or overweight women, none of them had hypertension or diabetes, but they had markers that were suggesting they were on the way. Okay, so I want to show you the last thing. In our study that we did 20 years ago, we did uterine artery Dopplers. We measured blood flow in the uterine arteries during pregnancy. This is, when you have nice diastolic flow like that, that means the blood just falls into the uterus. But however, when you look at early pregnancy, normal people with the black line, but the women who delivered preterm babies, the red line shows that their vascular resistance in their uterine arteries was significantly elevated. Significantly higher than normal people. When you look on the fetal side, that's an umbilical artery, that's blood flow in the fetus, you can see that actually at 18 to 20 weeks, on the left side, the first group of bars, actually it was a little bit better than normal women. However, at 28 weeks in the middle part, 28 to 32 weeks, it was significantly elevated. So the fetus looked at its mother, says, there's something going on at 28 to 32 weeks, and it increases its own vascular resistance. So this is an example of fetal programming, where in utero, the fetus can pick up a signal from the mother, poor blood flow, I got to do something. So it itself gets hypertensive. And then look at later on, it continued to go up. So this is an example of fetal programming. So today we are confronted with things that happen before pregnancy, during pregnancy, that affects the health of the child. And the question is, how are we going to do something about it? By changing people's attitudes and habits as children, as young adults, in the preparation for pregnancy, so you can enter pregnancy in the best possible health, to improve your health and improve the health of your child. Thank you.